Welcome to the office.
Number one issue is what? What motivated you to come?
I just feel out of balance and my hips seem to be out of line. My feet
Okay.
are not, and my knees look like they're.
Everything seems off balance, you're saying.
Yes.
How is it affecting quality of life to bring you to the office, though?
I work sitting down a lot,
Okay.
and so my hips are starting to feel like there's more issues.
So when you're sitting working, you work from home?
Yes, I work from home.
And you're on the computer?
Yes.
So now you feel that your hips are off balance and you're tilting?
Mm-hmm.
Is that correct?
Correct.
And through the tilting, you're feeling other stuff in the body?
And while exercising too.
Okay.
So then I feel the difference between my left side and my right side.
Okay.
I feel really tight.
When did all this start?
I think it's a combination of a couple of falls plus, I guess, the back
Major
posture.
fall? Major fall?
Major fall.
You fell off one of those motorized scooters?
I fell off of a motorized scooter.
When was that?
That was in 2019.
So, and we're in 2022, so about 3 years ago.
Yes.
Okay.
And I tried seeking help, but it wasn't long lasting.
Okay.
And
So you've had treatment, therapies, x-rays, made
Yes.
sure nothing was fractured,
correct.
no fracture.
No fracture.
Okay, you had treatment for how many months?
I want to say about 4 months, but
Okay.
I wasn't really feeling that anything was really clicking back
Okay.
into place. I lost some sensitivity in my hands.
Okay, right now you have loss of sensation?
Yes,
Both hands?
both hands.
All fingers?
More on the left, I would say.
Okay.
But aside of that, just not feeling really aligned.
Okay, so you're off balance, we want to get back in balance.
Correct.
And that's what we do here. Okay. We had one visit yesterday.
Mm-hmm.
How did you do with your adjustment?
It was great.
What happened?
I still feel like when I walk, I notice some difference, some relief,
Okay.
and I'm amazed how much it also cracked the left side.
It's
I wasn't expecting because I've been mostly complaining about my right side, but
we found something else, right?
yes.
How about we go over that?
Okay.
You ready to go over it?
Sure.
So what we're going to do, we did start with her yesterday. We had one adjustment. And what I do want to do is let's go over your x-rays. I'll explain what it is. We'll do the exam and we'll continue. We need to talk about this posture and balance that's affecting your quality of life. So number one is let's go here and let's look. And what can we see? We can see a few things. We can see that yes, the spine is, or the foundation is tilting down on that right side, causing a slight curvature, and then the body does what? It's compensating to come back to neutral, and then it's doing it again. So we have almost this double S curve. Yeah? And one thing I want to talk about is why does the body do this? Okay? And if the body didn't have these compensatory mechanisms to compensate for imbalances, then we'd be in a worse situation. What do I mean? So if in your case, for example, right side is down, it's causing the spine to go to the right. If the body didn't compensate, then where would the spine be? It would be veering off to that right side and we'd be walking on an angle, right? Mm-hmm. And we as we are biped predators from an evolutionary standpoint. And we have what's called the righting reflex. The righting reflex states that your body, as biped predators, will do everything and anything to maintain the head straight and eyes level. And you see people walking kind of like this, right? Mm-hmm. I'm not talking about the people looking forward. Mm-hmm. Okay. The righting reflex is the reason we have compensatory issues in the body and in the spine. Right side is down, left side is up. The sacrum is also tilting down on that right side. Because of the tilt, and we'll go to the other x-ray and explain about the upper part of the body, that we have an uneven weight distribution on the hips, so we're putting more load on the hips and especially on your right hip, and that's why it's getting a little bit whiter on the rim. The whiteness, we call it enuberation. It's a whitening or a thickening of the bone. And that's based on a principle or a law. It's called Wolff's Law. Dr. Wolff's Law, bone will grow according to the demand placed on it. So this just tells us the lifestyle. You're complaining all of this right side. Mm-hmm. Let's look at the numbers and see what it means. And this is what is so significant about this case, and we have quite a few cases like this. What do we have going on here? We have a 4 millimeter drop of her sacrum on the right. We have a pelvis that's gone up and out. But here's the most significant. We have a 19 millimeter measured difference between both hips. What Dr. Gonstead found is as long as this is under 7 millimeters, adjustments will hold, things will be balanced the best they can, and that's a normal variant. Correcting your pelvis will give us 1 millimeter difference. So the MD is the current measured difference, the AD is the difference, actual difference after correcting the pelvis. So what I said though is we have this tailbone issue. We have this bent tailbone on this side here that's causing this spine to go down on that right side. But is that in itself going to correct all of your imbalance? No. So we will, or we may need to put in that heel lift, right? And when we're looking at a heel lift, we'll talk about that a little bit later, but the goal for us is to get that under 7. Does that make sense?
Yes.
Okay. Now as we go up the spine again, same thing. We have compensatory changes. There is something here, this T2 is standing out to me. And that may be something we're going to need to address for your neck. T2 is a side slip. That was some other trauma. That wasn't a posture thing. Whether it was a slip, whether it was from that particular fall or another, I don't know. Okay? Let's go to the side profile and get you lots of answers now. Now, on the side profile, first thing we're looking at is her posture. And this is another piece of the puzzle. So, first thing in the posture, what do we see? Let's get that straight right there. First thing we see is she carries her upper body behind her foundation. This, if we look here at the C2 and C7 that I'm marking, this line should be here. And what it's showing us is she carries the upper body behind the foundation. All these muscles are working overtime just to keep you upright. Does that make sense?
Yeah.
Okay. Now let's look at her discs. If we look at her discs and her tailbone, what's the first thing we see? We see a lot of this from tailbone injury, okay, and that's why we wanted to start in the sacrum, okay? 5 is tilted, 4 is tilted, but the discs are good. These discs are all good. These discs are good. This looks bad, but it's good. It's from the tilting of the spine on the other film. As we go up, again, all good. We had an old compression here. You can see the kind of concavity of the front part with a little bit of spurring there. All of this, again, I'm just pointing it out. It's all compensation, okay? Let's get to the neck. That's an old whiplash injury. C2, 3, 4, 5, 6. C6 is the one that is posterior. 5 is compensating. We need to get this, start to get this curve back for you. So the take-home message here is what? We have foundation issue on the AP film, tilted down on that right side. We need to bring up, and we need to reestablish the curves in the spine. My job is to do the adjustments, advise you. Your job is to keep moving. Okay? Neutral, extension, no movement, flexion, no movement. Everything is coming from that C6. You can see that spinous is not moving there. Okay? So we have C6, T2 potential, sacrum, and pelvis. Clear? You ready to get started? Let's do it. Now, let's look at here. You can see the glutes. The right side is lower, left side is higher. You can see that this looks a little more pronounced. This looks a little flatter. This is up. This one is up and out. That's her AS. I'm going to be right here for a second. It goes up and turns out. So the glute on her left side is up and out, looks bigger and higher. That's the imbalance from the pelvis. As we go up here, you can see this tilting down, but she's compensated pretty well here. You can see this side is a little bit lower, this side is a little bit higher. When we look from here, come from this side here, you can see here's her upper body, here's her foundation, and you can see that this is behind the foundation. You can see the dishing of the spine here, the flattening. So we want to have a little bit more curve in her upper back. We want a little bit more curve in her low back. Okay? Now, let's walk. And let's see if she got it. Where are you from again?
Honduras.
Honduras! Let's see if she got the Honduran. Let's see if she got the Honduran wiggle or not.
Okay.
Let's walk to the corner of the room and back a few times, please. Hands on the side and swing, don't. Normal walk. Keep walking, Kathy. You're going to do this about 3-4 times, okay? So what are some of the things we see in her walk? You keep walking, I'm talking. We want to see the dimples moving up and down when she walks, okay? Let's watch that. What is she doing? She's going side to side, and you can see her kind of tilting down on that right side. You can see, and we will notice, that she's on her back right heel when she walks. So it goes back, instead of being like this, the heel goes like this and like that. That's from the tilting of the pelvis. So what's the body going to do to compensate? It's going to want to pronate the foot. And so we get a little bit of foot pronation, which will lead to a bunion formation in the big toe, which is what she's starting to get. And that's all coming from the drop leg. Keep going, please. One more time. Yeah. So you can see the imbalance when she walks. Okay? Come on over here, Kathy. Let's get started. Have a seat there, please. Starting at the base of the neck, head down just a bit, please. There you go. And the first thing we're getting is C6. 10 points, C6, left side. And you can see it goes all the way down to about T11, T12, left side. 10 points, sacrum down low, and that's what we talked about, right? We're down in the low. And we have 5 points today down low, 10 points. Now, what's interesting, it would have been kind of cool yesterday. She had, remember yesterday? It was almost 3 times the size, and I talk a lot about this, that people think this is back fat. This is swelling inflammation in the tailbone from the imbalance. So if I do my job correctly, what should naturally happen? This should disappear, and it's already more than halfway down. Yes, ma'am?
Yes.
Okay. Feet together. Let's check the motion. Feet together, open and close your knees with your feet touching. We're checking general motion of the sacroiliac joint. Scoot forward a little bit. Feet together, open and close, open and close. Right side only. So when she does the right, the whole left wants to shift with it. Left side only. When she does the left, the right is more independent. You feel that? Mm-hmm. Sit back for me, please. Let's do static palpation. Head down just a tiny bit. And for static palpation, we're looking for swelling, edema, point tenderness. And you can see the swelling starts and pulls right there. Tender. Mm-hmm. 2, 3, 4, 5. 5, 4, 3, 2, 1, or 12?
12.
12. Okay. Now let's check down low. Let's do L5. Sacrum, S1, S2, S3, tender, S4, tender, yes?
Yes.
S5, see? And that, compared to yesterday, is tender. Is it less though?
Yes, it is less.
But it is still there, S5. So that's S5 on coccyx. 5, 4, 3, 2, 1, 12. We have 12, S5 on coccyx, and C6.
I just felt something in my knee when you were touching me.
Down in the coccyx?
Yeah.
There you go. Sit back for me, please. You know, we talk about the nerve chart, right? And when we're looking at this, part of this is called the Merrick chart, where We know general nerves the major nerve supplies that go to all these different organs, and the major nerves, whether we're following dermatomes or myotomes, the specific nerves that go to all the various muscles, right? But here's the thing, anything can cause anything, and everything is connected. You know, we had a really interesting case of a coccyx fixing this lady, a dancer's hip, and no one found that. And it was just through the physical exam. So, how do you say a coccyx affects the knee? You can't, but you can feel the objective finding. Okay? Now, 7, 6. We're doing movement, motion, palpation. 6, 5, 6, 7, 1, 7, 6. We're going to continue on. Okay, so we're going to do 6 today. We're going to do S5, and then we're going to do T12. Actually, we're going to wait on the 12, ma'am, okay? And the reason why, it's part of that compensatory we talked about, right? It's part of the compensatory curve. We'll do 6, S5 sacrum, and then we'll recheck.
Okay.
You ready? All right, let's do it. And C6, we're going to set it as the listing shows as a PRS, posterior right superior. Let's put the right hand up, please. You got to put a seatbelt on. All the way back. There you go. Is that okay for you? Hands down, palms up, resting on your thighs, feet all the way out, please. There you go. C6, PRS. We're going to start it right here. We're going to be right under the spinous there, and we want to get a good lift. All right, nice and easy there. Right side down, down. There it is. Good. Home run. Perfecto.
Wow.
Let's walk it off once. Not bad.
A lot lighter.
A lot lighter.
Yes.
Okay, let's do the low back. Okay, bottom leg straight, top leg is bent. Hi. Okay, and what we want to do, the left side is down. Okay, we're going to do 2 things. We're going to do ASEX, pelvis, and then we're going to go to the other side to do the coccyx. That's what we did. Hi. For ASEX, I'm going to be from the PSIS, 1, 2, 1, 2, 3. I'm going to be right there, ma'am, okay? AS, EX. And the majority of the listing is AS, so we really just want to bring that pelvis down. Can you relax there for me the best you can? We're going to go down and in, just like that.
Wow. Thank you.
You're welcome. Let's go to the other side now.
Wow.
You want to walk it off once? Go walk. Let's see what happened.
Ooh.
Walk it off. Dígame.
I feel like a baby.
You feel like a baby?
Taking new steps, you know.
Keep walking. Getting a little more movement in the pelvis. Nice. Okay, now for the S5. Okay, S5 coccyx. Left side down over here, please, facing me this way. You ready? Are you nervous?
No,
You're not nervous, right?
I'm excited.
There we go. Now for S5 coccyx, I will be on the outside, okay? Right there. See?
Yes.
So what I'm doing is we're bringing it up to the S5. And I gotta be as specific right there. Okay? Gotcha. There it is. Good. There.
Yes. I even felt it all the way up here.
Come on up. Walk it out. Stuff.
Ooh.
Things are gonna shift around.
Yeah, I felt something kind of click.
Walk it out. But when we adjusted, everything was at the bottom. And the stretch as you're walking is gonna start releasing a lot of stuff. Go ahead and walk for me, please.
Yes.
Keep walking. Check it out.
So things are still clicking and so.
Keep walking.
Wow.
Turn around, let me open the back please so we can see. All right, check it out. Go ahead and walk it out. What do you think, Shasha? Different, huh? Pretty cool.
Yeah, I hear a lot of clicking too on the knee and the hip and even in the back.
Things are gonna start loosening up, okay?
Yeah, I had like a belt of pain like right in the middle here and I'm not feeling it right now.
Let's see, that was the T12 area that you're pointing at. Look how she's sitting now. Diferente. Mira. Top is not behind now. And it's more comfortable, yes? Head down, please. Oh, mariposa. Mm-hmm. Twelve is clear. I'm not messing with it. L5 sacrum is clear. Mira. All the way back. 5. 1, 2, 3, 4, 5. See?
Yes, I don't feel it.
Very nice. May I continue?
Yes, please.
Okay, we're all set there. Let's work on more balance through the ears. Gotcha. Shoulders, let me do the work. Nice. Nice. Come on up and let's work on the ankles. Boca arriba, aquí. Raise your right leg. So what did we learn today about the mid-back and all of this stuff coming from the, where?
From the S5?
From the foundation.
Or, yes, the foundation. I guess that makes more sense.
Back over here, have a seat. And let's do a buff and polish on the back. Head down, 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 down. Well, stand up for me, please, and let's check the hands. Squeeze. Squeeze. Hands are solid. I'm not messing with your hands, okay? That's where we're starting. C6, left pelvis, S5 coccyx. Okay? This is visit number 2. We'll see you a couple of times this week before Christmas.
Okay.
Okay? Questions, comments?
No, thank you.
You're welcome. Welcome to the office.